Have you ever had a massage, treatment, or good night's sleep and thought, finally, it is better? Then 1 day later, or 2 days later, the same pain comes back. Maybe it is your neck after a long day at the computer, your shoulder after training, your back after lifting, or your hand when you return to work. So what does that mean? Did the treatment fail? Did the therapist miss the real problem? Or did the relief only cover up something that is still damaged? The honest answer is usually more useful than any of those explanations. Pain returning does not automatically mean the treatment failed. It also does not automatically prove that something is being damaged again. It means the situation needs a little more context. One important distinction is the difference between short-term relief and longer-term change. Pain can change quickly. A treatment may make an area feel calmer, less threatening, or easier to move. That change can be real and valuable. But feeling better for a few hours does not necessarily mean the area can already tolerate everything you were doing before. Relief can arrive before capacity has changed. This is why treatment can be useful without being a reset button. Imagine that the painful area has been receiving more work than it can currently handle. Lifting, gripping, running, sitting, mouse use, or repetitive hand movements. The problem is not always one dramatic event. Sometimes it is a small demand, repeated hundreds of times. Treatment may reduce sensitivity and make movement easier. But if you return to the same workload, lack of breaks, or poor recovery, the symptoms may return because the irritating conditions are still there. This does not mean you have to blame your posture. There is no single perfect position that protects everyone from pain. The more useful question is often not, what is the correct posture? It is, what is this area being asked to do, for how long, and how often can it change? This is where the boom and bust cycle appears. On a good day, you feel better and do everything you have been avoiding. Then the area flares, and on a bad day, you stop almost everything because movement feels risky. A more useful approach is pacing, choosing a manageable amount of activity and building from there, instead of waiting until pain forces you to stop. That may mean taking breaks, doing a shorter training session, dividing a task into smaller parts, or changing position before symptoms become intense. The goal is a more predictable relationship between activity and recovery. Recovery matters too. The same task can feel different after good sleep, poor sleep, a stressful week, an illness, or unusually high workload. Stress does not mean the pain is imaginary. It means the body and nervous system are operating in a larger context. When someone is tired, worried, overloaded, or not recovering well, normal sensations may become harder to tolerate. That is why the same treatment can feel helpful on one day and too much on another. The dose and the next step may need to change with the person. So where does massage fit? Massage can create a useful window. It may reduce discomfort enough for someone to move, breathe, sleep, or reconnect with the protected area. But the window is not the whole house. If the area feels better, ask what useful activity can happen next. A short walk, gentle movement, a shorter work task, a break, or a change in tomorrow's load. The point is not to force exercise through severe pain. It is to use improved comfort to explore what the body can tolerate gradually. This also changes how we judge treatment. Instead of asking only, did the pain disappear permanently? Ask, can I move more comfortably? Can I do a little more before symptoms rise? Do I recover more quickly? Can I return to something meaningful? These are different kinds of progress. Pain may still appear sometimes, while function, confidence, and tolerance improve. That does not mean every recurring pain problem should simply be pushed through. Severe unexplained pain, major trauma, fever, unusual swelling, new weakness, new numbness, or symptoms that are rapidly worsening deserve medical assessment rather than repeated treatment alone. If a symptom keeps returning in the same pattern, look more closely at the activity, workload, recovery, sleep, stress, and response after treatment. Do not automatically chase every recurrence with more pressure. Sometimes more pressure is appropriate. Sometimes the better next step is less pressure, more variation, a gradual movement plan, a change in workload, or proper assessment. So why does pain keep coming back? Sometimes the area is still being asked to do more than it can currently tolerate. Sometimes the nervous system remains sensitive, recovery is poor, or activity swings between doing too much and doing almost nothing. And sometimes the original problem needs a more complete assessment. Pain returning is not a final verdict on the treatment. It is information. Ask what changed, what stayed the same, what the area is being asked to do, and what small useful step is possible now. The best treatment is not always the one that makes pain disappear for the longest time in one session. It may be the one that helps you understand the pattern, move with more confidence, and gradually build a body that can handle more of your actual life.